Have you ever held your baby and felt their body burning with fever, and suddenly your mind goes blank? Your hands start shaking, your heart beats faster, and for a moment you feel completely helpless. Every second feels like something terrible could happen. And that fear pushes parents into panic, a panic that leads to mistakes. Mistakes that actually make the fever worse instead of better. But you're not alone. Almost every parent has been there. Today, I'm going to share the 5 most common mistakes parents make during infant fever, and how to avoid them. These simple changes can protect your baby, keep the fever under control, and prevent serious complications. If you've ever worried during your baby's fever, this video might bring you more relief than you think. 1. Giving fever medicine too quickly. The moment parents see the thermometer touching 100 or 101, panic hits like a wave. Their first instinct? Run for paracetamol. But here's the shocking truth: giving fever medicine too quickly can actually make things worse. Fever isn't the enemy, it's the body's natural defense. Imagine your baby's tiny immune system fighting a battle, and you stop it before it even starts. Many parents keep giving doses again and again, thinking it will break the fever. But instead, it overloads the liver, masks symptoms, and sometimes causes the fever to bounce back even higher. What your baby really needs is comfort, rest, and the right dose at the right time, not constant medication. Fever medicine should only be given when the baby is uncomfortable, not every single time the number rises. Calmness helps more than panic. And informed decisions protect more than guesses. 2. Wrapping the baby in heavy clothes. When a baby gets fever, parents often feel their hands get cold and immediately think, "My baby is freezing." So they wrap them in blankets, shawls, sweaters, anything to warm them. But here's the shocking part: this innocent habit traps heat inside the body and raises the fever even more. Imagine your baby's temperature trying to go down naturally, but the heavy clothing acts like a pressure cooker, pushing it higher. Many parents don't realize that cold hands and feet are normal during fever. It doesn't mean the baby is cold, it means the fever is rising. By covering them thickly, you stop the body from cooling itself. The safe way is to keep your baby in light clothing, allow air to circulate, and let their body breathe. Fever needs space to settle. Overwrapping turns a simple fever into a dangerous spike. 3. Using cold water or ice packs in panic. Parents reach for cold water, ice packs, or even alcohol rubs. Anything to immediately bring the fever down. But this emergency reaction shocks the baby's body in the worst way. Imagine warm skin suddenly hit with ice-cold water. The tiny blood vessels tighten instantly, trapping heat inside instead of releasing it. The fever actually rises. Many babies start shivering, crying, or getting more restless, and parents don't understand why their treatment made things worse. Alcohol rubs are even more dangerous. They can be absorbed through the skin and cause poisoning. The right way is gentle, calm, and slow: lukewarm sponging, soft cloth wiping, and maintaining a cool, airy room. Fever goes down gradually, not through force. Using extreme temperature changes is like scaring the body instead of helping it. What looks like quick relief becomes a silent risk. 4. Not giving enough fluids. One of the most hidden mistakes is forgetting hydration. During fever, a baby's tiny body loses water with every breath, every cry, every drop of sweat. But parents focus only on the thermometer and forget the bottle. This mistake is shocking because dehydration makes fever harder to control and brings new dangers: dry mouth, sunken eyes, weakness, irritability, and even hospitalization. Imagine a baby already fighting infection, but now also fighting thirst. Fever medicines don't work well when the body is dehydrated. Babies refuse feeding, and parents assume it's normal, but it's actually a warning sign. The right approach is small, frequent sips, breast milk, formula, ORS if advised, or a little water for babies over 6 months. Hydration cools the body from inside, supports the immune system, and speeds recovery. Missing fluids is like taking away half the baby's strength during fever. 5. Delaying medical attention. This is the mistake that shocks parents the most, waiting too long. Many think, let's see one more day, maybe the fever will settle. But sometimes, that one day can change everything. Especially for babies under 3 months, any fever, even a mild one, is a medical emergency. Their bodies can't fight infections the way older children can. Parents often misread symptoms, thinking the baby is just tired or just fussy, when in reality, the baby might be showing signs of serious infection. Continuous crying, rapid breathing, refusing milk, vomiting, seizures, or fever lasting more than 3 days. All these are signals parents shouldn't ignore. Delaying medical help allows the illness to grow silently. Early treatment is not fear, it's protection. Listening to your baby's signals, not your assumptions, is what keeps them safe. Every minute matters when a tiny body is struggling. At the end of the day, every parent wants just one thing: to keep their baby safe. Fever can feel scary, it can make even the calmest parent feel lost. But now, you know what to avoid. You know the signs. You know the right steps. And that knowledge alone can protect your baby more than anything else. Remember this: a fever is not your enemy, it's your baby's body fighting for them. And your calm decisions help that fight. So the next time your baby feels warm or cries from discomfort, don't panic. You're not the same parent you were before this video. You're stronger, smarter, and more prepared. And your baby is lucky to have you.